The very last part of the assessment is going to be the remaining neurologic system and then closure with your patient. We're going to assess first for gait. If your patient's able to, have them stand, and you're just going to have your patient walk to a location. You can have them walk to the door and then back to the bed. You're going to get behind the patient. You're going to be looking for symmetry, ease of movement. Do they seem to be in discomfort? And coordination. Have them walk back to the bed. And you can see here, Professor Bird didn't seem to have any limitations or discomfort when moving, so that's a normal finding. And then next, you can have your patient stand still. And I just like to put my hands on either side of the patient just for safety in case they get really wobbly. But this is the Romberg test. So you're going to have your patient close their eyes and just stand still. If your patient sways slightly, that's a normal finding. That's pretty normal. But if your patient has to open their eyes or they have to step in a certain direction, that would be an abnormal Romberg. And then again, with your patient standing and their eyes closed, we're going to be assessing cerebellar function with the alternating index fingers to the nose in rapid sequence. So both arms out, patient still closing their eyes, and then quickly touching the index finger to the tip of the nose. And you're looking for coordination here. Any ataxia, like if they miss their nose and touch another part of their face, that could be a sign of ataxia. And then finally, you're just going to have your patient sit down. You're ending with patient comfort. If they were laying down, you can assist them back to a laying position or wherever they were. We're just assessing for comfort, making sure they're not in any pain, making sure they have their call light in reach, bed is down to a low position, table within reach, assessing if they need anything, if they need to use the restroom, if they need any water, things like that. And then performing medical asepsis, washing your hands, and then, of course, thanking your patient. And that's it.